Hi everybody, this is Rich Sanders with Southern Health Lawyers, and this is the weekly Health Law News Nugget for April 3rd, 2018. Well, last week was a big one on Wall Street. Walmart, one of the nation's largest retailers, announced that it was in discussions with Humana to purchase that health insurance company. This is a trend that we've noticed on the Health Law News Nugget over the last quarter, as companies that have traditionally operated either on the margins of healthcare, as Walmart has, with both pharmacies and in-store clinics in some of its operations, but not across the board, try and get into the healthcare delivery business. Now, Humana, of course, is an insurance company, but Humana also has clinics and delivery care mechanisms across the nation. So this appears to be an effort by Walmart to not only enter into the healthcare delivery business at a greater level than it has historically, but appears to be a competitive response to what we talked about in the News Nugget a couple of weeks ago, and that is that CVS's move to buy Aetna. Now, CVS announced at the time that it moved to acquire Aetna, and those talks are still proceeding. CVS announced that it was a great idea for us if we could get a hold of Aetna, we get a hold of its customers, and that's a great way to kind of lock in the customer base. How does that apply to Walmart's discussions with Humana? Well, the same logic applies. Humana has obviously health insurance business both at the commercial level and Medicare Advantage plan level across the United States, and Walmart would do itself a lot of good by having really an inroad into the Medicare business that Humana has through its Medicare Advantage programs. In fact, one analyst who looked at this on behalf of CNBC reported that it made a lot of sense because whichever of these entities gets its best footing for the senior population is probably going to be best positioned for the long haul in healthcare. So, and furthermore, Walmart and Humana already have a couple of pilot programs that are throughout the country where they have a prescription drug program under Medicare Part D, at least was reported by various news sources. So there's already some groundwork been laid between Humana and Walmart as they work together. The discussions are proceeding, but more importantly for watchers of the Health Law News Nugget, it's yet another indication that businesses that have not traditionally been in healthcare are looking to get some foothold into this giant industry, which is 18% of the gross domestic product. Stay tuned for future developments on what's going on in the business and politics of healthcare by watching the News Nugget. Thanks for joining us and have a great week.